Thomas in the house. No, I ended up not coming.
Thank you, everyone. Welcome back. Thank you for joining us today. We have letters from the speaker. Clerk, will you read in the letters?
Dear Mr. Clerk, I am making the following changes to committees for the 102nd Legislature. Representative Lori Stone will be removed from the Agriculture Committee. Dear Mr. Clerk, I am making the following changes to committees for the 102nd Legislature. Representative Jennifer Conlon will be added to Agriculture.
Clerk, can you please take the attendance?
Chairwoman Miller,
Here.
Representatives Heiss,
Present.
Young,
Here.
Copia,
Here.
Conlon,
Here.
Evendorf,
Here.
Fitzgerald, Reingans,
Here.
Nyer, Vanderwall,
Present.
Roth, Bierlein, Smith. Madam Chair, you have a quorum.
Vice Chair Rep. Heiss moves to adopt the minutes of October 25th, 2023. Today, we will be hearing testimony on House Bill 4849, also known as Queenie's Law. Please note that there is a substitute, and Rep. Colazar will be speaking to the changes. We have many presenters today, and with the exception of the bill sponsor, presenters, please limit your testimony to 5 minutes, and members, please hold your questions until the end of everyone's testimony. First speaking will be the bill sponsor, Matt Colazar, and Ryan Merkley, Director of Research Advocacy from the Physicians Committee for Responsible Medicine. Welcome.
Thank you, Madam Chair, and thank you, Vice Chairs, members of the committee. I appreciate the opportunity to discuss House Bill 4849. I introduced this bill because Michigan isn't doing enough to protect dogs in labs or promote the replacement of dogs in painful experiments. The bill has been amended, and the substitute is before the committee. And it has been amended so that it now only focuses on dogs used at public institutions. When we allow our public research institutions to inflict suffering on man's best friend, we fail those dogs and we fail patients who need better therapies and treatments. In 1978, the legislature gave the state the authority to regulate and establish standards for animal experiments. But 46 years later, the state hasn't used that authority, which rests with DHHS. In 2022, Attorney General Nessel issued an opinion about this law, stating that DHHS must register entities that keep or use animals for experimental purposes and must restrict registration to only those entities that conduct animal research in a humane manner. Certainly, inflicting pain on dogs is not humane. And the public agrees. A 2019 poll revealed that 70% of Michiganders oppose the use of dogs in experiments that cause them pain, and 66% opposed public funding of dog experiments. When the public is so clearly united this way, it is our duty to act. I want to make it clear that some of our public institutions are doing better than others. According to public filings, the University of Michigan does not use any dogs that would be covered by this bill, as this bill only applies to painful experiments. I first became involved in this issue when I learned of the deadly heart failure and hypertension experiments conducted on dogs at Wayne State University. Those experiments have gone on for 33 years without benefiting patients. Cardiovascular disease is one of our state's biggest killers, and the people of Michigan deserve better. Wayne State and other laboratories will tell you they are in full compliance with the Federal Animal Welfare Act, but the Animal Welfare Act is disturbingly weak. The law doesn't prohibit any experiments, including those that cause pain, and is primarily a husbandry statute that regulates the size of cages, of cleanliness, food, and water. The U.S. Department of Agriculture, which is supposed to enforce the Animal Welfare Act, has been cited by its own Inspector General for unnecessarily closing investigations and significantly reducing fines for violators. The federal government's failures are why, in recent years, several states have passed laws prohibiting certain types of experiments or increasing oversight of facilities that use animals. In 2022, Virginia signed into law 5 bills that regulate the use and sale of dogs for experimental purposes. The bills were prompted by the repeated, troubling negligence of a Virginia research facility that also bred and sold dogs for use in experiments. Wayne State is one of its customers. Also, in 2022, California passed a law that would prohibit the use of dogs in the testing of chemicals, toxic substances, and food additives. In 2018, Virginia outlawed the use of state funds for carrying out painful experiments on dogs. In 2023, legislation was introduced in Pennsylvania that would prohibit the use of public funds for painful experiments on dogs. Health research can be conducted without inflicting pain on dogs, and speakers you will hear from today will discuss that. Laboratories routinely classify experiments into pain and not pain in terms of experimentation. This bill only addresses painful experiments. So when we talk about non-painful experiments on dogs, that is not addressed in this bill. This is only about painful experiments. Michigan's public institutions, which conduct research in our name, should be held to higher standards. I believe this bill is a humane, scientifically sound way to raise those standards. Thank you for your time, Madam Chair. I don't know if you want me to answer questions first or hear from Mr. Merkley first.
We're holding questions until we hear from everyone and get through all the testimony.
Okay. Good morning. Chair, members of the committee, thank you for your time. My name is Ryan Merkley. I am the Director of Research Advocacy for the Physicians Committee for Responsible Medicine, a global nonprofit with 900,000 members and supporters, including about 25,000 here in Michigan. We strongly support House Bill 4849, and your constituents do too. In just the last week, your 13 offices have received 1,226 emails from voters in your districts. Our scientists and physicians look for areas of research and testing where the use of non-human animals is failing to benefit patients, where non-animal human-relevant methods could advance scientific progress, and where the animals suffer greatly. That was the troubling combination of failed science and cruelty that caught our attention at Wayne State University. More than 10,000 pages of public records have revealed that Wayne State subjects otherwise healthy dogs to painful, deadly heart failure and hypertension experiments. The dogs endure multiple surgeries in which Wayne State employees cut open the animal's chest cavities, insert devices in and around major blood vessels, stab catheters into their hearts, and tunnel cables and wires under their skin and out between their shoulder blades. The dogs who survive the intensive surgeries are forced to run on treadmills while experimenters use the implanted devices to drastically raise their heart rates to 2 to 3 times the normal rate. This is repeated for days, weeks, or even months, depending on how long each dog can withstand it. By design, every dog will eventually die during these experiments when their bodies give out or an implanted device breaks or malfunctions. This bill is named after one such dog, Queenie, who was killed by Wayne State in 2010 after being used in experiments for 7 months. Queenie, a Dalmatian mix, had been a stray in Gratiot County before she was captured and sold to Wayne State. Wayne State will say that the dogs are not in pain. They'll say their staff give the dogs pain relief after the surgeries. But public records reveal that many dogs suffer from painful disorders, infections, and diseases. On September 23, 2019, 7 days after surgery, a female hound mix known only as dog number 2002 was struggling to breathe. After Wayne State euthanized her, a necropsy revealed that one of the implanted devices had created a hole in her aorta, which caused blood to pool around her lungs, resulting in a painful condition known as a hemothorax. She isn't alone. Many dogs die at Wayne State due to internal bleeding. Other dogs are found dead in their cages. That's what happened to dog number 4007, who was never given a name and who was, according to her records, quote, found deceased, unquote, in her cage on July 6, 2021. As Representative Kolazar pointed out, federal laws and rules related to animal research are incredibly weak and poorly enforced. But if you want to understand just how weak federal law is, look at this document. This is a dog enrichment log from Wayne State for dog number 2003, dated June 2022. It states, quote, single-housed animals must get approximately 10 minutes of human interaction every day, unquote. It It also says, quote, mirrors must be provided to animals that are housed alone, unquote. Wayne State has kept dog 2003 and hundreds like him alone in windowless basement cages, cables and wires sticking from sutures in their backs, and given them the bare minimum of attention. Wayne State and other laboratories at them, this is what it looks like to be in compliance with federal law, and it speaks to why states need to do more. These experiments have been conducted since 1991 without yielding any scientific advancements. And we know there have been no scientific advancements because Wayne State has been asked time and time again for such evidence. In 2021, when 11 state legislators wrote to University President M. Roy Wilson, he responded by writing of the experiment's quote-unquote potential. Over the last 33 years, Wayne State has killed hundreds of dogs and wasted more than $15 million in public funds. And all the university can say is that the experiments show potential. But it doesn't have to be this way. Human-relevant methods, such as trials involving patients, population studies, and cell-based and computer-based models mean that we do not have to subject dogs to painful experiments. Dr. Igor Efimov at the George Washington University uses diseased hearts from patients undergoing transplants or hearts donated for research to collect human-relevant data. The experiments at Wayne State have even been criticized by experts, including Dr. Michael Joyner of the Mayo Clinic, who himself conducts heart failure studies with human patients. The Texas Heart Institute, which is dedicated solely to addressing cardiovascular disease, stopped using dogs in studies in 2015. You'll shortly hear more on the science from Christy Sullivan from the Institute for In Vitro Sciences. Wayne State may be the worst offender, but at other public institutions in Michigan, dogs may be subjected to painful experiments. When trying to improve public health, research, and reduce animal suffering, the least we can do, the bare least, is to ensure that taxpayer-funded institutions are not inflicting pain on dogs. I hope you'll support this bill. Thank you for your time.
Thank you. Next, we'll be hearing testimony from Stephen Rapundolo, and also Mr. Dale Cooper. Please come up to the table, and also Rachel Cooper. Good morning. Who will be speaking today? All right.
I'll begin. Good morning, Madam Chair, members of the committee. Dr. Stephen Rapundolo, and President CEO of the Michigan Biosciences Industry Association. We represent the interests of the over 2,400 industry facilities and 44,000 professionals here in Michigan we're a top 15 cluster nationally, a $35 billion economic driver here in the state. And our members include academic and clinical research institutions, as well as companies engaged in the discovery, the innovation, the development and manufacturing of therapeutics, of devices, and products that save lives. As I've testified before this committee and others before, the use of animals is an integral and required component of the R&D process, and is, I must remind all of you, is mandatory by federal and international laws and regulations. Nearly every medical breakthrough in the last 100 years has resulted directly from research using animals and for the benefit of not only human health, but I should add animal health as well. In my written testimony, I'm going to cite through all the bodies, but it's highly regulated, and not just through the Animal Welfare Act. The two veterinarians with me here today can speak more specifically to those, but the bottom line is that these regulations and oversight are all there to assess animal care, treatment, and practices for each and every research protocol to ensure scientific justification for the use of the animals, the number of animals that are utilized, their welfare, and the inspection of facilities. And all have strict standards and protocols that must be met for the ethical and legal use in research and the highest level of humane care. In addition, adherence to the so-called 3 Rs, namely replacement, refinement, and reduction of animals, is used in research and testing, is not only encouraged, but is expected in almost all cases. So in summary, the entire enterprise of using animals in research is under robust compliance and reporting oversight, and that's the way it should be. Moreover, poor animal care makes for bad research. No self-respecting researcher or research organization is willing to jeopardize good science and meaningful outcomes, not to mention research funding based on poor study design and misuse of research animals. Now, with that said, the language in HB 4849, as well as the sub, is predicated on misleading and misguided terminology when using words like quote-unquote pain or distress or fear. The evaluation and interpretation of behaviors, health, and safety should be left to skilled professionals. In other words, the attending veterans and their teams, and that's required by the Animal Welfare Act, as they are the most suitable to ascertain animal welfare. In addition, any language should not conflict or preempt with federal regulations governing animal use. Now, Representative Kolazar alluded to an Attorney General's opinion, and it should be important to note that DHHS is supposed to be in the midst of promulgating rules regarding the use of animals in research. As an outcome of that opinion, and any legislative action, I would suggest, to regulate the use of animals in research should allow for that process to be completed before proposing any rules that may end up being in conflict with those rules. Moreover, and this is important, according to the AG's opinion, any rules that are promulgated cannot preempt federal regulations, and I would submit that the current bill does just that. Lastly, instituting onerous and impractical regulations covering animals in research would send a chilling message to companies and institutions that Michigan is not supportive of the life sciences industry. And this would have a serious economic impact and greatly hamper discovery and innovation at our world-class research institutions and cause flight of existing companies or a reluctance to expand and deter others from establishing research facilities. At a time when this legislature is contemplating economic development incentives to spur business growth, especially in high-tech industries like the life sciences, 4849 would be a blow to our competitiveness and negatively impact a major economic driver. And for all those reasons, we oppose 4849. And just a quick sort of comment about the sub. First of all, I would note that there is no other law on the books anywhere in the country to this, as stated here. Secondly, again, the language would conflict or preempt with federal regulations. And then lastly, I would again reiterate that you would stifle the very innovation engine at our research institutions, which really is the beginning of the commercialization pathway. All our company formation and so forth is all revolves back to the substrate that is generated by our research institutions.
Thank you.
It's okay.
Thank you for your testimony.
Is it okay for me to proceed?
Yes, please.
Okay. My name is Dale Cooper. I'm a veterinarian. I'm with Charles River Laboratories in Matawan, and I have 30 years of experience as a laboratory animal veterinarian, so I've really focused my whole life on the humane care of animals, and I'll emphasize of all species. We're talking dogs and cats here, but we apply the same standards to all vertebrate animals. So I think I have several concerns with the bill. I don't think it provides the intended benefit that it's thought that it will. I do agree that even though this applies to public institutions, it will actually affect private research as well, because we depend on working in an environment where we have trained professionals who understand science, who understand working with animal models, and who want to live in a state that supports that type of work. And I do believe that this bill would be redundant to the federal regulations. And as a taxpayer, I don't really care to pay for this twice. So the requirement for animals is something that, as mentioned, is required by federal regulations, and it's because it's scientifically necessary. The regulations don't specifically say you have to use a dog or a cat. What they say is you need to use the most scientifically appropriate model, and the model that has the highest sensitivity for whatever it is that you're testing. So we select the model based on the science. And when you put a regulatory requirement in, that goes out the window. So you actually hinder the research itself. We use alternatives all the time. I think the industry often says, well, there's no alternatives to animals. What they mean is there's no alternatives to that final step of translating from, say, a laboratory-based system into something complex like a human. But in fact, all of the basic research that's done involves the use of, cell culture, computer models, just a variety of laboratory-based systems. And even when we step into animal modeling, we go up the phylogenetic chain. We use flatworms. We use Drosophila insects. We start out with rodents before we would move into a larger animal model. So the industry itself really thinks a lot about this ethical issue of animal use and what is and isn't appropriate. And ultimately, it's about trying to understand what goes on in a system as complicated as a living body. You can't make a model for something you don't understand. We don't understand everything about how the body works. And because of that, the industry is actually constantly revising its approach. Every time you run a study, every time you develop a new drug, you're looking backwards at the research. And the idea that some research done at Wayne State hasn't resulted directly in a drug, that's not how research works. This is basic information. This is the base of the pyramid that you need before you can get up to here. And without that, but can you draw a direct line? Maybe not. I think I also agree that the definitions of pain and distress in the bill are misleading. We have this idea that research is something bizarre, but in fact it's medicine. We are studying medicine. There's no benefit from studying something that isn't normal medicine. We use the same procedures I learned in vet school to work with my patients that physicians learn when they work with you when you go into the clinic. And the standards of medical care that are provided are the same. We view pain and distress as an unwanted experimental variable. There's actually a committee process that oversees this at every institution that uses research animals and makes sure that the scientists have justified that they've looked at alternatives and that they are identifying the potential for pain and distress, and they have methods for mitigating that pain and distress. There's also an assumption in the bill that any time an animal receives an unknown drug, that's inherently going to be painful, distressful. Most of the time that isn't true. And when there are adverse effects from the experiment, that's when the veterinary care steps in, and we make sure that animal is taken care of properly. There are other aspects of the language of pain and distress that are frankly not accurate and misrepresent what's in the federal regulations. So overall, I don't think this bill is necessary. I don't think it's going to achieve the result that's intended because the work has to be done somewhere. It will just be done outside of Michigan. Thank you.
Thank you.
Good morning. Thank you, Chair Miller and members of the committee. My name is Rachel Cooper, of no relation to Dr. Dale Cooper here, but I'm also a veterinarian at a contract research organization here in the state of Michigan, and that is Northern Biomedical. Thank you for hearing my testimony this morning in opposition to Bill 4849. Act 368, which Bill 4849 proposes to amend, opens with numerous statements, notably protecting and promoting public health as being one priority or purpose, and providing for the prevention and control of diseases and disabilities. Bill 4849, if enacted, would impede achievement of these objectives within the state of Michigan and would fail to enhance the welfare of animals contributing to vital research. Personally, I'm a pet parent to an aging Great Dane with severe spinal arthritis. He remains active and comfortable due to an extensive medication regimen, including multiple pain medications that have been tested in recent years for safety and efficacy in dogs, right? The best model for dog patients. I have a father who survived for several years following placement of a cardiac stent. And I also have a mother-in-law who is alive today only because of an extensive regimen of chemotherapeutics, immunosuppressives, and a bone marrow transplant. Prior to FDA approval of these treatments for humans, they were tested for safety and efficacy in the appropriate animal models, which is a necessary step for the protection of public health. Of course, in addition to my personal connection, which I hope many of you can relate to as well, my professional background as a veterinarian, also with board certification in laboratory animal medicine, does qualify me to address this issue. As I mentioned, I'm currently the attending veterinarian at a small research organization. And in that role, really the welfare of the public, the welfare of pets, the welfare of research animals, and other animals that we all love is my personal priority and actually my professional oath. Like many other research facilities, both public and private, Northern Biomedical works with dogs that are purpose-bred for research and other animals that are acclimated and accustomed to our specialized enriched environments and our highly trained caretakers and research staff. While the use of animals is avoided whenever alternatives are available, as previously discussed, unfortunately, these alternatives do not always suffice for assessing product efficacy and safety, or for developing the requisite scientific understanding of physiology and disease in a living animal model. Bill 4849 focuses on dogs without any apparent scientific basis. And as referenced earlier, working with species other than dogs when a dog is the most appropriate based on scientific evidence would not only be ethically unacceptable, but would also conflict with federal principles, regulations, and guidelines governing drug development and animal research in general. Therefore, this research would remain necessary, but would move elsewhere, impairing the ability of our public institutions to attract and retain scientific experts and to remain competitive both nationally and internationally. Additionally, Bill 4849 declares, again, routine procedures conducted in accordance with gold standard veterinary practices to cause pain or distress in dogs, which again is a misrepresentation, as these procedures, as discussed, are performed with appropriate anesthesia, pain medications, nursing care, and monitoring, just as they would in a veterinary hospital. Both internal and external oversight, including by veterinary medical officers with the USDA, contribute to the rigorous protection of animal welfare. So to conclude, research involving dogs is often a necessary step in advancing science and medicine, is supported by the American Medical Association and the American Veterinary Medical Association, is conducted under vigilant oversight of institutional and external experts, and is performed with animal welfare as a top priority. The proposition to prevent essential animal studies runs counter to the legislature's interest in promoting public health, and therefore I urge all committee members to reconsider House Bill number 4849 in light of this information. Thank you for your attention.
Thank you for your testimony. Up next, we will have Christy Sullivan, who is the VP of Education and Outreach with the Institute for In Vitro Sciences. Welcome.
Okay, thank you and good morning.
Good morning.
My name is Christy Sullivan. As you said, I am an Ann Arbor resident and Michigan native, and I am vice president at the Institute for In Vitro Sciences. I work on education and outreach of other scientists. Our nonprofit organization operates one of the world's preeminent in vitro and research and testing laboratories. We also provide technical and educational resources to companies and regulatory agencies like the Food and Drug Administration and the Environmental Protection Agency. In fact, I just left a workshop that we're currently holding with the Food and Drug Administration about in vitro methods. Since completing my Master of Public Health degree at the University of Michigan, with a focus on toxicology and public health genetics, I've spent the last 22 years building expertise on the issue of non-animal research and testing. I have served on international scientific committees within the Organization for Economic Cooperation and Development, which sets international testing standards, and have provided training to state and federal agencies, including in California and then federally EPA and FDA. I've served also on a number of advisory panels, including the Center for Research on Ingredient Safety at Michigan State University. And I currently serve as a member of the executive boards of the Society of Toxicology, In Vitro and Alternative Methods Specialty Section, and the American Society for Cellular and Computational Toxicology. And as a scientist and a guardian of a beagle like those used in testing labs, I strongly support this bill, HB 4849. Of course, the bill would only impact public institutions like universities. However, I want to briefly help you understand the current regulatory structure as it relates to dogs. I have worked with and served on conference panels with regulators from the Food and Drug Administration, and they repeatedly make it clear that they are interested in data, not specific tests. In a July 2021 statement, the agency confirmed that, quote, the FDA does not mandate that human drugs be studied in dogs, unquote. Drugs that prove safe in non-human animals fail in human clinical trials 95% of the time. President and CEO of Vanda Pharmaceuticals, Dr. Mihail Palmeropoulos, has said, quote, there is no evidence that long-term studies on dogs add any predictive value to human safety, unquote. That immense failure is a big reason why we're seeing an international effort to replace animals in drug testing and chemical testing. This can be achieved with a number of alternatives, as has been mentioned. These are small, high-tech devices about the size of a thumb drive. These are called tissue chips, which are one of the most popular and promising methods. They can be lined with human organs from healthy or diseased donors, and they allow scientists to acquire data quickly without having to translate it from another species. For example, researchers at Harvard have developed patient-derived tissue chips to study kidney and lung dysfunction associated with kidney disease and respiratory disease. There are also heart on a chip or cardiac system on a chip models. Scientists are even developing patients on a chip, devices that use an individual patient's cells to model rare diseases and cancers linked together with different organs in the body to assess the metabolism and impact on different organs. The goal is to use these systems to develop patient-specific treatments. The EPA, for their part in chemical testing, is also investing millions to implement more advanced human-relevant methods to test chemicals and products because it's better science. They also removed their pass requirement to test most pesticides on dogs about 10 years ago. When it comes to cardiovascular research, there are a number of ways to do this without dogs. Researchers are using cardiac muscle cells generated from human stem cells to engineer heart tissue as a 3D model. This model provides a more physiologically appropriate environment for monitoring heart functions than experiments on dogs. I also wanted to briefly address the 3 Rs, reduction, replacement, and refinement. This is, of course, a popular scientific concept that's referred to demonstrate a commitment to something to be achieved in the future. But in my career as a toxicologist, I have seen universities and companies all over the world use animals many times, not because they were required to, because that's the way it's always been done. That's what they've done before. As someone who has dedicated her career to making research and testing more human relevant, and as someone who loves the state and wants to see it take a stand against unnecessary cruelty, I urge you to support this bill. Thank you for your time.
Thank you for your testimony. Up next, we will hear from Tanya Hilgendorf, Executive Director of the Humane Society of Huron Valley. Welcome.
Thank you.
You may begin.
Chairperson? Yeah. Oh, okay. Hello. Thank you so much for allowing me to be here today. I am Tanya Hilgendorf, the CEO of the Humane Society of Huron Valley. We are an award-winning no-kill shelter in Washtenaw County, serving roughly 25,000 animals a year. I also speak as a proud graduate of Wayne State University with 20 years of experience rescuing and overseeing the medical care of thousands of sick, injured, homeless, and abused animals. I am here as well as the chair of the Michigan Pet Alliance, which is a state association of shelters, rescues, animal controls, and animal lovers striving to improve animal welfare in Michigan. Both HSHV and MPA strongly support House Bill 4849 to stop painful experiments on dogs at publicly funded institutions. Alleviation of suffering is core to animal welfare and is at the heart of our discussion today. To consider our ethical obligations to protect dogs from the unnecessary infliction of pain. As you've just heard, the dogs used at Wayne State undergo multiple surgeries so invasive that many die soon after. The dogs who live long enough to have their hearts sped up using implanted devices while running on treadmills suffer even worse fates. Veterinarians have called out the unrelenting pain these dogs likely experience. For those who do not think this is an excruciating experience for the dogs, I wonder if they might offer up their own dog in such an experiment. We know that pain management in animals is extremely difficult and complex. Consider the challenges we still face in human medicine and pain management. As someone with lifelong chronic pain, I can personally attest that we still have a lot of work to do. On certain days, no matter what I've been prescribed, getting on a treadmill would be torture. Even so, it is our human ability to use language, words, to describe our pain to medical professionals that is the cornerstone to accurate pain assessment and treatment. Animals have no such ability. I know many of you are loving pet owners and may also know the personal responsibility and anguish of trying to alleviate your own pet's pain. As with our personal pets, we in the public have an ethical obligation to prevent unnecessary pain and suffering of animals used publicly. If we allow painful and invasive experiments like those at Wayne State or any public institution that have failed to produce any benefits for patients, we fail that obligation. We now know that research using animals for human medicine is highly unreliable. For example, roughly 95% of drugs tested on animals fail in human trials, which is why the FDA no longer requires animal testing. These cruel and invasive studies are based on archaic medical models, old science. Yes, people and dogs both have hearts. We are genetic cousins, but our biology is far too different for animal testing to tell us what will work in humans. This is why, according to many experts, we are not finding the cures we so desperately seek and are wasting billions of taxpayer money. And please also remember that dogs are dogs. Those used in research suffer the same as your family dog might. The only difference is the use of breeds who typically freeze and cower in pain instead of fighting back. You have heard the USDA and the Animal Welfare Act may protect dogs in labs from pain and trauma. Couldn't be further from the truth. The regulations are outdated, they're extremely weak and minimally enforced, and do just enough to keep animals alive in their misery. These animals need the state, you, to protect them. So this bill is the minimum that we can do. We want to protect taxpayers, animals, patients, and the majority of Michiganders who find the intentional and cruel harm of dogs, our best friends, abhorrent. Thank you for your time.
Thank you. Next, we will hear from Blake Goodman, State Director of the Humane Society of the United States. Thank you, Mr. Goodman, for joining us this morning.
Thank you very much. Good morning. On behalf of the Humane Society of the United States and our supporters across Michigan, thank you, Chairwoman Miller and members of the committee for the opportunity to provide testimony in support of HB 4849, known as Queenie's Law, introduced by Representative Kolazar, for whom we're also incredibly grateful for taking on this task. This legislation, as you've heard, would prevent and prohibit experiments that cause pain to dogs at public institutions and establish oversight of this practice by the Michigan Department of Health and Human Services. The Humane Society of the United States strongly supports and advocates for both animal protection and public health. In light of this goal, I'm especially grateful for this committee and this legislature's ongoing commitment to the health and welfare of animals enduring painful experimentation across our state. Already this term, members of this committee have worked to turn Michigan into the 16th state where laboratories performing experiments on dogs and cats must make good faith efforts to put healthy individuals up for adoption at the conclusion of their lives as lab animals. With this hearing today, legislators and animal protection advocates now can now come together to end the use of Michiganders' tax dollars on unproductive and painful experiments performed on dogs at our public institutions. Dogs that are used in experiments suffer terribly and are kept in empty steel cages, often alone. They may be force-fed drugs, pesticides, or other substances and are observed for harmful effects such as heart failure, signs of cancer, or even death as a result of that. Some tests involve administering chemicals at extremely high doses, to dogs over a prolonged period, causing slow and horrific deaths. Dogs and cats are often killed after studies so that their tissues and organs can be examined. At the same time, as you've heard, dog tests do not ensure human safety and have scientific limitations that never will improve. No longer the gold standard of testing, animal models will always contain serious scientific limitations. Different species can respond differently when exposed to the same exact chemicals, and even different sexes or subspecies can react inconsistently. Comprehensive scientific analysis reveals that dogs are very inconsistent predictors of toxic responses in humans and suggests that predictions of toxicity based on canine data are little better than those obtained through tossing a coin. It is no surprise that, as you've heard, nearly 95% of drugs that are first tested on animals fail when subsequently tested in people, with about half failing due to unanticipated human toxicity. Finally, science is rapidly moving away from outdated animal tests as many faster, less expensive, and more human-relevant alternative methods become available. Simply put, we need not trade Michigan's future as a national medical research leader away for HB 4849 to become the law. New, innovative methods based on human biology are much more likely to provide results predictive of human responses. Human cell-based tests and advanced computer models, for example, as you've heard, deliver human-relevant results in hours or days, unlike some animal tests that can take months or years. Passage of this legislation today will not only prevent dogs from experiencing painful experiments on our dime, but push forward the development and adoption of alternative testing methods that forego the use of animals altogether. Again, thank you for the opportunity to testify today. Once again, on behalf of the Humane Society of the United States, we request that the members of this committee vote yes on HB 4849 when it comes up for a vote. Thank you very much.
Next, we'll hear from Beatrice Friedlander, Attorneys for Animals. Thank you for joining us today. Please have a seat and start when you're ready.
Chair Miller, committee members, and Representative Kolazar, thank you for the opportunity to submit testimony. My name is Beatrice Friedlander, and I am the president of the Board of Directors of Michigan-based Attorneys for Animals. We're a nonprofit 501c3 organization of legal professionals and animal advocates. Our board voted to support 4849. I was a founding member of the Animal Law section of the State Bar of Michigan. During my more than 40 years of legal experience, I've been a guest lecturer at the University of Michigan, Wayne State University, and Michigan State University. I am an adjunct associate professor at Madonna University in Livonia, teaching animal law and policies. I also served on the Michigan Department of Agriculture and Rural Development Companion Animal Advisory Committee from 2003 to 2005. I am here to support House Bill 4849. Michigan already has the legal authority to regulate the humane use of animals in laboratories, and it has since 1978. Attorney General Nessel affirmed that in 2022 with an official opinion. At the very least, we can start by ensuring that experiments involving dogs are conducted humanely, and that means prohibiting the infliction of pain on dogs. More specifically, our public institutions have an obligation to reflect the ethics of taxpayers who fund them. As Representative Kolazar stated, Michiganders are overwhelmingly opposed to the use of dogs in painful experiments, especially when conducted at public institutions. When voters are clearly so united against something, it's the legislator's duty to act. More and more individual states are stepping in to regulate the use of animals in labs because the federal government is falling down on the job. In 2022, Harvard Law School sued the USDA for secretly handing over much of the responsibility of regulating labs to an industry-backed third party. That case is still pending. The journal Science reported that because of this policy, some labs are only being partially inspected. A March 2023 opinion in a separate case ruled that this policy by the USDA is arbitrary and capricious. In 2021, National Geographic reported that the USDA was ignoring animal welfare violations in favor of business interests. Clearly, the federal government has demonstrated the inability to ensure that animals in labs are humanely treated. And even if the Federal Animal Welfare Act were properly enforced, it still fully allows for painful experiments. But House Bill 4849 provides the opportunity to fill this gap and to stand up for ethical research. I would like to take the remaining amount of my time to make several points. 1 minute. There's an old canard that says, look back over hundreds of years and all the medicine has been a result of experiments on animals. That's because that's all we've had. That's a false equivalency. Let's look ahead when more alternatives are used, and that's the real test. One other thing is the Department of Health and Human Services is dragging its feet on making these rules. I would like to call it regulatory underreach. And I would ask this legislature to step in to fill the gap. I urge this committee to pass out House Bill 4849. Thank you.
Thank you for your testimony. Up next, we will be hearing from Dr. Robert Sain.
First of all, do you guys think I will make it to the table? If you can.
Do you need assistance?
I'm getting it, thanks.
Okay. Can someone step up?
Hands will do fine. He's stronger than you are. Thanks very much, guys. It's one benefit of being 81. You see, everybody thinks you're senile, and I am.
As he's about to give testimony, okay.
Well, it's a privilege for me to be here, and I hope that to support you're all in passing Queenie's Law, I call it. I am Robert Sain, a community child psychiatrist, starting at Maxie Boys Training School in 1984. That was before they closed it down. Humane Society of Huron Valley sent an email to me, and I was interested to find out what this was about. So I talked with Karen Patterson at the Humane Society, and my connection to Queenie took me right back to a course I took in medical school. It was called dog surgery, and we were to take out organs one at a time on different days. I think it was 3 days. And the assignment was to, in my case, to remove one kidney, and the last student took out one side of his pulmonary system. Since we were 150 medical students in this surgery, if we had 3 students per dog, we killed 50 dogs. The issue of, it bothers me when folks dismissed the idea that animals don't have feelings, and my feeling was a post-traumatic stress. As soon as I was talking with Karen Patterson about Queenie's Law, I started crying. It's this, I've completely repressed the experience that I had in Denver. The trauma for me, I mean, I must have buried it for a long time, since 1977. I remember when they started dumping the animals into large barrels, plastic barrels, right in front of us. There was no issue to dealing with our feelings. And I remember crying with one of my fellow students on the stairway. We needed to stop, I guess. I don't know about him, but he was crying before I did. So it was a devastating experience then, and it's obvious that I didn't deal with it because talking to Karen Patterson opened the door to my feelings about what I did and what happened to the dog. The dog, by the way, was a friendly, warm dog with a tremendous personality, and I feel very bad that I did that because I certainly was too anxious before the let's call it an experience. I was asking where these dogs came from, and a lot of them did not have identifications. And certainly the dog we had was obviously was raised in a warm home because the dog was warm and friendly. So I thank Karen because I had a catharsis about this memory, and crying with her on the phone was another release of the feelings that I went through in doing this course, which in retrospect was not intended to do anything useful other than to give me a traumatic experience. I'm sure that the two of us on the stairs who were crying for half an hour, we weren't the only medical students who were affected negatively by being responsible for killing this dog. And it's true, just like Queenie, at some point she died 7 months later from the experiences that she had. The process of bringing a dog into the experience that we had with the dog took gathering 50 dogs and being told to us, medical students, that they had carefully taken care of the dogs, which I know is not, I mean, in retrospect, it was not true. They got any dogs they could get and didn't do any, no favors for me as now a child psychiatrist. Does this mean you're going to kick me out?
It means you're going to need to wrap up.
All
Thank
right,
you.
so the point here is that I would like to support you. It's not just the dogs that have the pain, but it's those of us in medical schools who have this experience, and I'm not sure this was something they wanted to do to us, although as a child psychiatrist, I learned a lot of empathy for the kids, and that's the reason I'm here.
Thank you.
I'm an animal lover, so what can I say?
Thank you so much for your testimony.
Thank you.
We'll get you assistance, doctor?
Sorry?
We'll get you help.
He's a wonderful fellow.
Yes, he is. So our last speaker will be by virtual. It will be Robin Downey. Can you hear us?
I can. Can you hear me?
I can't, there you go. There you are. Thank you. Good
Yes.
morning. You may
Good
start
morning.
when you're ready.
All right. Well, good morning, and I apologize for a little congestion. It's really a privilege to be able to be here today. I'm Dr. Robin Downing from the Downing Center for Animal Pain Management in Windsor, Colorado. I am both a doctor of veterinary medicine and a doctor of bioethics. I'm an internationally respected animal pain management expert. I was a founder of the International Veterinary Academy of Pain Management and served as that organization's second president. I'm an affiliate faculty at the Colorado State University College of Veterinary Medicine in the Anesthesia and Pain Management Department. And I led the task force that created the very first set of pain management guidelines for dogs and cats in veterinary medicine. I also served as both a pain expert and bioethicist on the task force that created the first palliative and end-of-life care guidelines for dogs and cats. I am here to speak in support of House Bill 4849, and in these comments, I do not represent any particular organizations with which I am often aligned or affiliated. I would like to frame my remarks with this quote from the physician humanitarian Dr. Albert Schweitzer, who wrote the following in the early 1900s about people who experiment on animals. Schweitzer wrote, "It is their duty, the investigators, to ponder in every case whether it is really and truly necessary to sacrifice an animal for humanity. They ought to be filled with anxious care to alleviate as much as possible the pain that they cause. Dogs are not just another piece of laboratory equipment. They are sentient, conscious beings who form multiple complex relationships. They are highly intelligent and they lead rich emotional lives unless they are deprived of the opportunity. The Physicians Committee for Responsible Medicine has identified that despite more than 30 years of these torturous experiments, there have been no human health improvements derived from them. The next logical question then is, were all those dog deaths meaningful in any way? Despite the overlap between human and veterinary medicine, dogs are not small humans. Queenie, the dog in question in the genesis of this bill, was subjected to very invasive surgeries in service of this experimental protocol, including cables dragged under her skin to make them stick out of the skin on her back in the area between her shoulder blades. Imagine having cables dragged under your skin, left there, and then being asked to run on a treadmill. This is not some sort of squishy anthropomorphizing. Anatomy is anatomy, and disrupting that anatomy will have the same impact whether you are a dog or a human. I remain very skeptical of the investigators' comments about how well these dogs performed. As for the trauma and pain associated with these surgeries, there was a woefully inadequate response to the level of pain induced. After the second surgery, Queenie was actually immobilized by her pain, attempting to bite the handler who tried to force her to stand. In any veterinary practice, a dog experiencing chest and abdominal surgeries like these would have the benefit of several days of continuous intravenous delivery of potent pain medication. Poor Queenie received nothing of the sort. Because animals live in the immediate moment, unable to project or speculate into the future, while we understand that they cannot and do not anticipate or fear their own death, they certainly can and they do anticipate and fear pain. It's important to understand that Queenie's pain was both physical and emotional. The fear, anxiety, and stress that Queenie experienced throughout her ordeal was physically expressed and reflected by her unrelenting diarrhea. Emotional states have extensive influence on
Ms.
the bodily
Downing, you're going to
health
have to
of
wrap up.
animals,
Excuse me.
and which is, in this situation, can actually taint the experimental data, rendering it useless. So one final consideration. All that Queenie was subjected to in this experiment came to naught because the notes reveal problems with the devices. So let us circle back to Schweitzer and ask if it was really necessary for Queenie and her cohorts to be tortured and killed for humanity. Respectfully, I submit there was no benefit to any of this, and we humans who have complete control in this situation have a moral and ethical obligation to prevent circumstances like this in the future, and that's what this bill is designed to do. Thank you very much for your time.
Thank you. At this time, we will now take members' questions.
Want to read the cards first and then questions?
Oh, no.
Okay.
Rep. Reingans.
Thank you, Madam Chair. My question is about, I heard some people testify that this would apply to publicly funded entities and some talk about public entities. The substitute that we have before us as committee members is not yet the bill we're specifically talking about because we haven't voted to approve the substitute. But within the substitute, it clarifies that this applies to public bodies. State, city, village, township, county school district, public college or university, single-purpose government agency, or any other body that is created by law. It does not talk about publicly funded, right? So this, if this substitute's adopted, this would only apply to public bodies, not to publicly funded bodies, because a lot of public funding goes to private entities. Can you clarify?
That is correct.
So this would only apply to public bodies,
Correct.
not to
That's-
any entity receiving public funding?
We'll get 100% clarification for you, but that is my understanding, yes.
Okay, thank you.
Representative Nyer.
Thank you, Representative Colazar. Who is going to be determining the level of pain? What's acceptable, what's not acceptable?
Thank you. These levels of pain are actually very well prescribed and identified. So in the early 1990s, the U.S. Department of Agriculture set forth regulations, and in the Federal Register, they specifically said that these upper echelons of pain categories, which are laid out in the bill, they're known colloquially as categories D and E. So when you use animals in experiments under federal regulations, you report them in 3 different pain categories, C, D, and E. This bill only applies to the D and E categories, which the U.S. Department of Agriculture and experts have identified as painful categories. These are levels of pain, in levels of areas of research where you expect the animals to experience pain. And so it only applies to those, and the bill specifically says, not only does it identify the types of procedures that would cause pain, but it also explicitly says if this were to be done, it would be reported under categories D and E. And so it's very laid out, and laboratories all around the country categorize these different pain levels.
Representative Diefendorf.
I just want to seek clarification in some of the testimony offered by opposing stakeholders. We heard the terms requirements and mandate a number of times in regard to federal standards, but it's my understanding that as of the FDA Modernization Act 2.0 that was signed by Biden at the end of December 2022, the requirement that drugs in development be tested on animals prior to being given to humans in clinical trials was removed, so that there are not mandates anymore, but there are still options at this point for entities to test on animals. Is that true, that the mandates and requirements have been removed, but as of right now, there doesn't exist an all-out ban, according to the FDA?
That is correct. However, I'd also want to hone in on the fact that we are here to talk about dogs. And as Christy Sullivan from the Institute for In Vitro Sciences pointed out, there is no federal requirement by the FDA by the FDA specifically to use dogs in drug testing. They have explicitly said there is no requirement for dogs. I also wanted to point out that the folks from Charles River who are up here and the other contract research lab, those are the kinds of entities perhaps more likely to conduct federal agency regulatory testing, as opposed to what happens at Wayne State. These are experiments that have gone on for 33 years without any FDA involvement whatsoever. So the dog experiments at Wayne State and often at universities are not being done to meet any government regulatory requirement whatsoever. They're often exploratory in nature. And so they've been exploring for 33 years.
Representative Vanderwall.
Thank you, Madam Chair, and again, appreciate everybody being here. Listening to the testimony, there is some concern that I have. And I think that every one of us in this room are pet lovers, but we forget that ultimately there are a lot of testing that goes on to make sure that we save our pet. And now through this will eliminate some of that that testing availability if we do these things that will actually benefit and potentially save the pet that we have living at our house. Is that correct?
No, not necessarily, for a couple reasons. One of which is that a great deal of veterinary research is clinical in nature. And what I mean by that is just with like human clinical research, there are ill or sick animals who take part in trials in which drugs are tested, and these are dogs who could benefit from those trials themselves. So I don't think there's any clear evidence that this would actually interfere with the exploration or development of veterinary medicine.
Well, I guess I'm going to push back a little bit just because the way that I read the bill basically says we cannot use a dog in testing. If we're specifically using medications that are there to benefit a dog's life, if we can't test a dog, that's how I read the language of the bill. And I guess I'm just concerned that we're just blanketing a statement here and we're dealing with emotion. And I think all of us love our pets. I think that's how I read the bill. And I don't know where it says in there that we can't do that.
Well, there actually is a carve out for the kind of clinical studies I was just talking about, where someone might volunteer their sick dog for a trial. So there is a carve out in the bill. But I'd also say that while this is an emotional issue for many people, as so many legislative issues are, you just heard from scientists and a animal pain expert that this is more than just emotional, and that the science of pain is actually increasingly clear when it comes to these things. So I think it's actually rather scientifically informed.
Okay. Well, I would appreciate if you can show me where the carve-out is. I think as we run on emotion and we make a decision, I want to make sure that we're not actually putting our dogs into, I want a dog to be able to live with me as long as I possibly can. And I understand that we're looking at some of this in the human side, and we don't want to pressure a dog or put a dog through this, but there are opportunities that give us the chance to make sure that we're going to save our pet. And I couldn't find where you're saying that in here, so if you can help me.
I'll show it to you, Rep. I can show it to you right after committee.
Thank you. Representative Nyer.
Thank you. This would be aimed towards Doctors Coopers and, sorry if I butcher your name, Rapundelman. Yeah. There was several mentions of new technology that makes animal testing irrelevant or less needed. I guess I'd like to get your opinion on that. Are we moving towards that at a good pace, or is it ever going to be able to completely replace the need for some type of live animal testing?
Well, I can begin. That kind of work has been going on for decades. I mean, I've been involved in that in my prior career in pharmaceutical research, and it continues today. And I think one of the earlier speakers, highlighted some of the models that are available. But one has to keep in mind that those types of models have to be broadly validated by the scientific community and, most importantly, accepted by the regulatory bodies as being predictive for whatever the intended purpose and function is. And that's not necessarily true universally, but that is ongoing. And in fact, the FDA has a work group, a task force that has been in existence for a number of years that reviews those types of models continuously. I don't know if you guys can shed any further light on that.
Yeah, I mean, the industry itself is very motivated to continue to develop these technologies economically, you know, for no better reason than that. They're often more efficient than using animal models. They tend to be very repeatable, and you can do you know, very precise modeling of very specific systems. It's that piece where you try to bring it all together. And you know, as a reviewer of protocols before they get approved, sitting on our Animal Care and Use Committee, we look at all of the information they provide that was generated based on these in vitro models, as well as, you know, work done in rodents or something like that, before we would approve something to be done in a dog. And you know, we feel like we have a good understanding based on all of this information. And frankly, 9 times out of 10, we're surprised by something that we find once it goes into a dog. And it's just, that's just the way it is. We're not that far along in science yet. I think we all want to get to the same goal. We actually even agree on the methods of getting there, except for apparently this bill. So.
And I will clarify briefly that the FDA Modernization Act does, you know, include the availability of alternative models as contributing to the, you know, the information, say, that's submitted to the FDA on behalf of a drug, but does not eliminate the requirement in some cases for use of appropriate animal models.
Yeah, I just wanted to thank you for bringing that up, because I wanted to clarify earlier comments. The Modernization Act made 2 very specific changes. One was to specifically articulate that alternative models could be used, and secondly, it did remove the requirement for use of animal studies, but only in the case of so-called biosimilars, so biologics that are similar to other biologic drugs. But those originating biologic drugs had to have gone through animal studies in order to get their approval. So it's very, very specific as to what was brought into the act.
Representative Conlon.
Thank you, Madam Chair. Yeah, no, I have a cousin who worked in an animal research lab at the University of Michigan, granted with rodents, but I saw incredible humanity. She had names for her rats. She cared a lot about them and packed them up to go to the Netherlands for other universities to study them with snacks and water, and cared a lot. But dogs are different, and I worry about the pain level classification of D&E and what that kind of slippery slope could be for research, because I have a dog that has to be anesthetized to have his nails cut. So that is traumatic for my dog. So I guess I'm wondering about that. But my specific question is, how would this bill actually impact current research efforts across the state, knowing how many NIH grants we do have here in the state of Michigan?
I can probably answer the first part better than the second part. So the, just to clarify, the D&E category, D is the potential for pain or distress, but some type of care has been provided to alleviate that pain or distress. So it's a little bit misleading to say that everything that's in category D is automatically experiencing pain or distress. E, that is the definition of it, is that they have actually experienced pain or distress and you have not done anything to relieve it. Category E studies are extremely rare in the industry. So I think that's important to understand, is that there is a lot of work already being done to try to alleviate any potential for pain and distress, you know, prevent it from ever happening. And the way that the bill is worded would automatically put something into the D category, even if the animal never experiences any clinical effects from the test article.
I would also add, relative to an earlier comment about universities or public bodies not having to follow FDA rules. That's probably true, But all the universities, public research institutions do have to follow the animal welfare rules propagated by, under the Animal Welfare Act and all the other accreditation and certification bodies. So they are no different than what Charles River or Northern Biomedical has to follow. The rules are the rules. If you use animals, you have to follow them, period, end of story.
Representative Kafia.
Thank you, Madam Chair. Thank you, Rep. Colzar, for this bill. Two things. One, in terms of discussing what constitutes pain, if we're talking about cutting open the animal's chest cavities, inserting devices in or around blood vessels, stabbing catheters into their hearts, and tunneling cables and wires under the skin and out through the shoulder blades. It's interesting. I know my dog would find that painful, and I bet all of us in this room would. But my question actually is to my colleague's point about not dealing from emotion, but fact and data and research and numbers. I heard earlier in testimony that $15 million has been spent on this to Wayne, grants to Wayne State since 1991 when the experiment started. I was a freshman in high school. That was a long time ago. That's been going on a long time. I'm curious whether Wayne State plans to speak to their experiments. I didn't notice Wayne State here speaking to defend the practice today, and I'm curious, the Wayne State University president told the legislators who wrote several years ago with concerns about this that this had potential. So again, since I was a freshman in high school when this started, can someone tell me what treatments or therapies have directly resulted from positive progress from the dog experiments at Wayne State? Could anybody speak to that for me, please?
I'll try to speak to that with the caveat that I'm not speaking on behalf of Wayne State, obviously. But since my background was in cardiovascular, I don't know. These are, in many cases, I suspect, these are what's called basic research. You're studying the physiology, the biology of these animals under certain circumstances, whatever the models are, and trying to understand what is going on at the physiological level, at the cellular level, at the molecular level, the genetic level, and trying to not only understand the normal state, but what is undergoing in disease. And from those kinds of learnings, then perhaps you can identify potential proteins or enzymes or whatever that become targets for drug development and so forth. So this adds to those kinds of studies add to our basic understanding of animal and human physiology.
I guess my point is, in 31 years since I was a freshman in high school, can we trace any specific scientific advancement that has occurred out of 31 years of these experiments on dogs with $15 million of taxpayer money? And again, I would love to have the folks from Wayne State come and answer that question for us.
Thank you. Representative Reingens.
I must have waved my hand twice.
Okay.
My question
No
was answered.
problem. Representative Peiss.
Thank you, Madam Chair. I'm not quite sure who this is to because I didn't write down the person's name, but it was mentioned here that one of the dogs was a stray and a Dalmatian mix. So this seems to me then that there's no standard control group that happens when these experiments are going on. So it really makes me think twice about the efficacy of any findings that you have. And in turn, it seems like unnecessary pain then. So I don't know, has this changed over the years or what's going on with this?
I can't speak to the specific details of those particular studies conducted at Wayne State, but in general, having a normal cohort is a requirement in pretty much all cases.
Well,
Otherwise, how can you discern differences in whatever manipulations or conditions and such?
Right, but if you have a dog or stray with a heart problem, then doesn't that affect then your experiment because, hey, you just got them off the street?
I can clarify
Or,
that.
a dog that used to have worms, let's say it's affected their heart, they recover from the worms, but then they go into an experiment, and how does that affect your results then?
Yes, it's absolutely important to have healthy animals in order to study, and that's why in modern ages, we use purpose-bred animals that are genetically similar to create useful control groups for animals that are undergoing, say, exposure to experimental agents. These are animals with defined health status, regulated breeding environments and laboratory conditions. And again, it's one reason that, say, clinical trials in pets don't hold the same weight as well-designed, controlled laboratory studies in purpose-bred animals.
So how did this stray Dalmatian get into a study then?
I'm not sure if this was the
I don't think any of us
example
know the
from...
details of Queenie.
I'm sorry.
Yeah, was this the
Okay.
example from 1977?
That was you, okay.
Yeah.
I've got some more information. Could I?
Okay. Yes.
Thank you for your response.
Hi again. So for most of the first 22 to 23 years that Wayne State conducted these dog experiments, they used dogs from what are called Class B dealers. These are notorious animal dealers, a couple of them based here in Michigan. And so for the first 20-some years, those dogs came from Macomb and Gratiot County and other places in Michigan. After we started telling the public about what was happening at Wayne State stopped that practice, and they now buy dogs. Since then, they have bought dogs from places that breed them for research. I want to be very clear, and you've heard this from a couple experts in animal behavior and pain today. The phrase purpose-bred is often used in the industry, and it's used, I think, to classify dogs who are bred for research as somehow other than the dogs who share our homes. But they are not, and anyone who has had a rescue beagle from a laboratory will tell you that they are no different. I also want to point out that between 2013 and I think it was about 2019 or 2020, Wayne State bought dogs from a place that was at one point in Vigo, and before that, Covance, it was called. It was a place in Virginia that was shut down 2 years ago because of its abhorrent welfare conditions. Dead puppies sitting in storm drains, one veterinarian overseeing the care of thousands of dogs. The Department of Justice, the U.S. Department of Justice, and the U.S. Department of Agriculture seized thousands of dogs from that facility and found atrocious conditions. And this was the place that Wayne State was purchasing dogs from. This is a place that, up until it was closed, was sending dogs all across the country to laboratories. And so the idea that these places are breeding dogs and they are genetically similar and their health is well cared for is incredibly misleading, and the U.S. Department of Justice would agree with that.
And if I may, just one more, real quick. Has MSU Veterinary School weighed in on this? How would that affect any research that they do?
Yeah, I don't believe and Representative Kolozar is confirming. We haven't heard from MSU Vet School. And one of the reasons, to be clear, to go back to Representative Vanderwall's comment, one of the reasons there is a carve-out for clinical veterinary research is because there is a lot of benefit to the animals involved in those studies. And if a guardian of an owner wants to volunteer their sick animal for those studies, this bill allows for that.
And this is targeted towards universities only? University research and not private, like Charles River?
Yeah, exactly. It wouldn't apply to Charles River or Northern Biomedical.
Okay, thank you.
There being no further questions, we'll now read in cards. Not wishing to speak, who opposes the bill? Thomas Stahl. Not wishing to speak, who opposes the bill? Rob Steklowitz, Charles River Laboratories. Not wishing to speak, who opposes the bill? Danielle Ferguson, Michigan State University. Not wishing to speak, opposes the bill? Zodis, representing himself. And I have one more card here. Not wishing to speak, but has submitted a letter, who supports the bill? Lily Tomlin. Yes, Lily Tomlin. That Lily Tomlin. And I will read the letter that she submitted. As a child of Detroit, former Wayne State student and animal lover, I am writing wholeheartedly to endorse House Bill 4849 ever since I've first learned of the horrific experiments conducted on dogs at my alma mater. I have hoped the university would make compassionate and scientifically correct decisions to end them. But since that doesn't appear likely, I'm overjoyed to see that Representative Kolozar's bill is given serious consideration. This legislation reflects the values I have seen in the compassionate people of Michigan. There can be no doubt that the public is opposed to the use of dogs in painful taxpayer-funded experiments. This is not simply an issue of Wayne State. When our public institutions inflict pain on dogs, they do so in our names, and they erode the trust that we place in them. I hope you will support House Bill 4849 and work to make it law. Thank you for your time and attention to this important legislation. Lily Tomlin. There being no further business before the committee and no excused members, we stand adjourned. Thank you, everyone.